Very much, Stuart, and welcome everyone to tonight's event. I'd like to start by acknowledging that I'm participating from the traditional lands of the Guringai and Gadigal people of the Eora Nation, and I'd like to pay my respects to elders past, present and emerging. Tonight we're the last of our Royal Society of New South Wales Hunter Branch's public lectures for 2020. And I'd like to thank you all for your support of the lecture series over this difficult year of 2020. I must say that as a branch, we really chose quite a year to launch the Hunter Branch. Tonight's lecture will address the critically important subject of planetary health. It'll be delivered by Professor Tony Capon. Tony Capon directs the Monash Sustainable Development Institute and holds a chair in planetary health in the School of Public Health and Preventive Medicine at Monash University. A former director of the Global Health Institute at United Nations University, Tony is a public health physician and authority in environmental health and health promotion. His research focuses on urbanisation, sustainable development and population health. Tony has more than 30 years of leadership and management experience in practice, policy, research and education. Previously, Tony held professional appointments with the University of Sydney and the Australian National University. He was the founding convener of the Climate Change Adaptation Research Network for Human Health in Australia. Professor Capon will be joined tonight by two panellists, John Vanderkellan and Georgia Brown. John Vanderkellan is the current chair of Doctors for the Environment Australia. John is a rheumatologist who grew up in Sydney and completed his medical degree at the University of New South Wales. He subsequently worked in a number of regional and metropolitan hospitals before completing his rheumatology specialisation in Leiden in the Netherlands. He has lived and worked in the Hunter for over 20 years. Georgia is an undergraduate student at the University of Newcastle and is one of 2020 national coordinators for Code Green, the Australian Medical Student Association's climate and health portfolio delivered to 17,000 medical students across Australia. Georgia has been involved in student organising at both university and national levels and is the incoming 2021 National Student Committee Chair for Doctors for the Environment Australia. Distinguished Laureate Professor John Aitken will act as our moderator tonight. He'll collate and direct questions at the end of the lecture to Professor Capon and his panellists. I encourage you, our audience, to use the Q&A facility available to you to submit questions during the lecture. Before inviting Professor Capon to speak, I'd like to acknowledge the contribution of Emeritus Professor John Bolton, who both suggested this topic and did a great deal of work to arrange tonight's event. Thank you, John. Tony, can I now invite you to deliver your presentation? Thank you very much.
Well, thanks ever so much for that introduction, Paul. It's a great honour for me to be with you all in the Hunter tonight. This evening I'm actually sitting in the foyer of a hotel in Canberra on Ngunnawal country, and I also acknowledge elders past, present and emerging. And it's really going to be a terrific conversation this evening. I'll be speaking for about 40 minutes, and then I'm really looking forward to a lively panel discussion with my Hunter-based colleagues after that. So let me get started by sharing the screen, and hopefully that's coming through clearly to you. Can you see that, Paul? Yep, and here. Yeah, excellent. Very good. So my topic, as Paul said, is planetary health, safeguarding health in the Anthropocene Epoch. I'd like to start with some images from last summer in Australia. Really exceptional bushfire season in the southeast of Australia in particular. This image from the far eastern part of Victoria with people seeking refuge on a beach. This image from Sydney, months of prolonged smoke pollution across a large metropolitan area in Melbourne as well. In our national capital, people wearing masks, not because of the pandemic, but because of the smoke pollution. And this were the images around the world over that December-January period in Australia. Quite extraordinary fire season that we're yet to fully process as a country, because the rains came, they doused the fires, and since then we've been responding to the pandemic in our country and around the world. And both of these things, those exceptional bushfires and this pandemic, are symptoms of this Anthropocene epoch. The bushfires are amplified in intensity and duration by climate change. The spillover of these novel pathogens, including the virus that causes COVID-19, SARS-CoV-2, that spillover of pathogens from animals to people occurs in the context of changing environments, changing social and environmental contexts, whether that's forest loss, urbanization, climate change, new opportunities for spillover of pathogens from animals to people. In the talk, I'd like to do 5 things. First, to make sure we're all on the same page about the challenges of the Anthropocene, and I'd like to use a short film, a 3-minute film, to help ensure that. Secondly, I'd like to reflect on some relevant history. Thirdly, to talk through key findings from the Rockefeller Foundation Lancet Commission on Planetary Health. Fourthly, some reflections on the need to think ecologically about health. And then my conclusions are around the so what about planetary health. So let's begin with this short film you can see here. I'll share these slides after the talk, of course, and we're recording it. But this link in Vimeo, if you'd like to watch this short film again afterwards. The film was used to open the Rio Plus 20 conference back in 2012. And I think it's quite a compelling short film. Let's watch it together.
This is the story of how one species changed a planet. The latest chapter of our story begins in England 250 years ago. Fueled by coal, then oil, several brilliant inventions appeared. They ignited the Industrial Revolution, which spread like wildfire through Europe, North America, Japan, then elsewhere. The great railways, then cars and highways, connected people across the globe. Medical discoveries saved millions of lives. New artificial fertilizers meant we could feed more people. Population rose rapidly. But this was nothing compared with what was to come. The 1950s marked the beginning of the Great Acceleration. Globalization, marketing, tourism, and huge investments helped fuel enormous growth. People swarmed to cities, which became even more powerful engines of creativity. In a single lifetime, the well-being of millions has improved beyond measure. Never have so many had so much, yet 1 billion are malnourished. In a single lifetime, we have grown into a phenomenal global force. We move more sediment and rock annually than all natural processes, such as erosion and rivers. We manage 3/4 of all land outside the ice sheets. Greenhouse gas levels this high have not been seen for over 1 million years. Temperatures are increasing. We have made a hole in the ozone layer. We are losing biodiversity. Many of the world's deltas are sinking due to damming, mining, and other causes. Sea level is rising. Ocean acidification is a real threat. We are altering Earth's natural cycles. We have entered the Anthropocene, a new geological epoch dominated by humanity. This relentless pressure on our planet risks unprecedented destabilization. But our creativity, energy, and industry offer hope. We have shaped our past. We are shaping our present. We can shape our future. You and I are part of this story. We are the first generation to realize this new responsibility. As the population grows to 9 billion, we must find a safe operating space for humanity, for the sake of future generations. Welcome to the Anthropocene.
So, as the credits for the film go up, you'll see that it was developed by the International Biosphere Program, IGBP, which is an interdisciplinary science program based at the Swedish Academy of Science. And while it's a very sobering film, it does finish with that positive message, a hopeful message that we can change, and indeed we must change in the interests of future generations. So I'd now like to speak to the findings of the Rockefeller Foundation Lancet Commission on Planetary Health. The title of the report, published in 2015 in the Lancet, one of the leading medical journals in the world, of course, was Safeguarding Human Health in the Anthropocene Epoch. And I was greatly honoured to be one of the commissioners on this global commission. At the time, I was directing the Global Health Institute for United Nations University and living in Kuala Lumpur. You can see a list of the other commissioners here, and we came from all parts of the world and all came from different disciplines. There was only a few of us that were human health people. They came from economic perspective, political perspectives, indeed bringing experience from business and government as well. And you'll see at the bottom of this slide, the bottom line, that the report, which is essentially an up-to-date literature review and key recommendations, did build on other work, whether it's the One Health approach to understanding health, which has gained some prominence indeed with the pandemic, an approach that brings together perspectives from human health, from medicine, human medicine, with veterinary medicine and environmental science. EcoHealth, another international network emerging principally from concerns about the health of ecosystems around the world and their importance for human health and well-being. And importantly, the Brundtland Commission. Here a picture of Dr. Gro Brundtland and the report of the commission she chaired, the World Commission on Environment and Development, back in the mid-1980s. And it's notable that Gro Brundtland originally trained as a medical doctor in Norway before she went on to be Prime Minister of that country, to chair this commission and indeed to lead the World Health Organization. That commission introduced the idea of sustainable development to world leaders, and it was an important I guess, a landmark in terms of thinking. And at the local level, the Agenda 21, which many councils are well engaged with, emerged from that work. And of course, more recently, the Paris Agreement is in the context of this work as well. This fellow is a very important scholar in planetary health thinking. His name is Tony McMichael, and you can see one of his books there on the right, Planetary Overload, Global Environmental Change and the Health of the Human Species. Tony McMichael was the first epidemiologist in the world to make the connections between climate change and health. He published that book back in 1993, almost 30 years ago now. And he died back in 2014. But the legacy of his work does inform a lot of what we do today in environment and health work. And indeed, Tony was a founder of Doctors for Environment Australia, which John and George are well engaged with. We can draw the history lens back further, though. Hippocrates, of course, in ancient Greece more than 2,000 years ago, Hippocrates considered the father of medicine now. And this was one of his books on airs, waters, and places. So Hippocrates in ancient Greece 2,000 years ago, he was talking to his patients. He was thinking about their circumstances, how they lived and where they lived, and he was making ecological deductions about the connections between environment and health well before we had modern methods of studying health conditions. So in some ways, we've let go of this ecological thinking in recent times, and we might come back to that in the discussion, because planetary health is about reclaiming these understandings. And of course, we can go further back to where we started, acknowledging Indigenous understandings. And last year, the International Union for Health Promotion and Education Conference was convened in Rotorua in New Zealand. And the framing was Waiora, a Maori word for well-being and healthy waters. And you can see there that the theme of the conference was promoting planetary health and sustainable development for all. So what do we find in the Lancet Commission? We found that by almost any measure, the human population is healthier now than ever before. And here, some World Bank data, life expectancy, you can see there on the left from 1960 through to 2010. And the black line in the middle of this chart is the world average life expectancy. So as you can see that in this 50-year period, world average life expectancy increased from the low 50s to the high 60s. And indeed now world average life expectancy is over 70. So health has been improving during this phase, phase of acceleration in consumption. Importantly also, of course, on this chart are the other lines, which are lines for life expectancy for regions of the world. And you can see the gross inequities in life expectancy for Africa, South Central and West Asia. In all countries, though, life expectancy is increasing. And within countries, we see these inequities too, for Indigenous people, for example, in Australia. So that's the human health story using that particular indicator of life expectancy. But in achieving those health gains, we've exploited the planet at an unprecedented rate. So whether it's escalating carbon dioxide emissions, ocean acidification, energy use, global deforestation, water use, fertilizer use, the list goes on. This is the great acceleration in consumption that really took off, as you can see in many of these charts from the middle of last century, around 1950. So what is planetary health? Put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. So it's about people and nature. And here, a schema from the Millennium Ecosystem Assessment, which was conducted when Kofi Annan was leading the UN back in 2005. And it shows us the range of links between environmental change and health. So on the left-hand side, escalating human pressure on the global environment. In the middle, environmental change and ecosystem impairments, climate change, stratospheric ozone depletion, forest clearance and land cover change, land degradation, desertification, wetland loss and damage, biodiversity loss, freshwater depletion and contamination, urbanization and its myriad effects, some positive but some negative, damage to coastal reefs and ecosystems. These are the things that we saw in that short film. These are environmental changes and ecosystem impairments. And on the right of this figure, you can see three categories of health effects. Firstly, the direct health effects, in the middle, ecosystem-mediated health effects, and at the bottom, indirect, deferred and displaced health effects. And if we refer to climate change here and think of the direct health effects of climate change, we're well familiar with injuries and deaths, other health harms from floods, heat waves, water shortages, landslides, exposure to ultraviolet radiation, exposure to pollutants. That's pretty clear and readily understandable. But in the middle here, on the right-hand side, the ecosystem-mediated health effects are less well understood in the wider community. Altered infectious disease risk, changing distribution and abundance of the vectors of disease, whether it's mosquitoes, for example, in relation to Ross River fever in Australia, dengue fever in Northern Australia and around the world, for example, ticks as well, but importantly, this spillover of novel pathogens. So we need to be thinking ecologically as well. And at the bottom of the schema, the indirect, deferred and displaced health effects. So diverse health consequences of livelihood loss, population displacement, including for slum dwellers in East and South Asia, for example, conflict, inappropriate adaptation and mitigation. We've seen loss of livelihoods with those bushfires on the south coast and the north coast of New South Wales, in Victoria as well, elsewhere. These effects are evident. We're already seeing them. Importantly, like that short film, much of the focus in the commission was on a positive message about meeting the challenges. We know a lot of what needs to be done. It's largely about getting on with it and continuing to learn as we go. And importantly, it's about the circular economy. Moving from a high consumption, wasteful economy to an economy where we value materials, where we focus on reuse, repair, and recycling. And indeed, we probably don't even talk about waste anymore because we understand that all of these materials are resources. The byproduct of one process is and potentially an input into another process. So we need to be thinking in this more integrative and circular way. And frankly, it is one area where the current Australian government is showing interest and And that is encouraging because they're not showing interest in many of the pressing issues here, but they are showing interest and concern in the circular economy, partly perhaps prompted by the fact that China is now refusing to take a lot of our waste that they used to take. So, you know, that's a changing world, and it influences us here in Australia. So our conclusions from the Commission were that solutions lie within reach and require a redefinition of prosperity, a focus on quality of life and improved health for all, together with respect for the integrity of natural systems. We identified 3 broad categories of challenges. The first were the conceptual challenges. We might call these failures of imagination. And here, a very good example is the way we measure progress. In a country like Australia, we tend to measure progress by tracking gross domestic product, GDP. If GDP is going up, we think we're making progress. Now, clearly it is important that we develop the economy. There's no doubt about that. It's very important for health, but it's the nature of the economy. What are the things we're doing? What are the impacts of those on human well-being and on the health of natural systems? And so if we just measure economic activity as GDP does, then we miss other things that might be happening at the same time. And to illustrate that GDP is a rather limited measure in this context, it might be useful to use a specific example. So if I was to say to Paul this evening, Paul, I've got $1 here for you to spend in Newcastle, and I'd like you to spend it in a way that maximizes the impact on the GDP of Newcastle. Now, one thing that Paul could do is take the $1 and go to a local shop and perhaps buy a banana or an apple. I think he could still probably do that for $1, and that would make a very modest contribution to GDP. But if he really wanted to get GDP going in Newcastle with a single $1, the best thing for Paul to do would be to buy a box of matches and start burning down buildings in Newcastle, and burn down as many as he could before he, of course, gets caught for arson and may even go to jail. But if he did that, the impact on GDP in the coming months would be quite substantial, because those buildings would have to be rebuilt. Now, if we just look at GDP, we might say that that was a good period for Newcastle. And that's why we need to challenge ourselves to think beyond GDP when we measure progress, because we need genuine measures of progress. That arson was not progress. I think we would all agree with that. But GDP would have gone up as the buildings were rebuilt. So that is a clear way of illustrating that we need more than GDP. We need measures of human development, education, health. We need measures of the state of the environment when we're thinking about progress. The second big challenge that we identified in the Commission is what we call governance challenges, failures of implementation, if you like. And one example that we used of progress in this area was the Wellbeing of Future Generations legislation in Wales in the United Kingdom. And this was enacted in 2015, and it was legislation to deliver on the SDGs in a Welsh context. It was legislation that required the government of Wales to consider the implications of the decisions they make for the well-being of future generations, not just the voters in the election, but who might be coming next in Wales? So thinking ahead, as Indigenous people do in their traditions, it's about thinking multiple generations ahead. And I have spent a bit of time in Wales with these folks and with the Commissioner for future generations. It's quite interesting the way they're thinking about their country's future. And one of the narratives is that Wales, of course, was one of the first in coal when Thomas Edison made that remarkable advance in technology in the late 1880s with the, in the late 1800s, sorry, I think it was 1882 actually, in London. That was a remarkable technological advance at the time. And of course, Wales has been mining coal ever since, but it had very substantial unintended consequences. And so that's why we now need transitions to renewable energy, transitions to new livelihoods. And that's what Wales is thinking about. They were among the first into coal, and they want to be among the first out of coal. So there are livelihoods for people in Wales. They don't want to be the last out of coal. They want to be on the front foot. So that's the second group of challenges that we identified. The third is what we call research and information challenges. And these are particularly relevant to universities. Failures of knowledge, we might think of them as. And this is where our silos in universities, our faculties, they do marvelous work, but we often are doing it in isolation of understandings across the university. And we now talk about the need for more transdisciplinary research. This is research that transcends any single academic discipline. The know-how of people in policy and practice and Indigenous know-how. It's about co-design, co-production of knowledge, focusing on the big problems of the age. And we need universities around the world, including in Australian universities. So here's a link to the Lancet Commission website. You'll find the 50-page Lancet paper, which takes a while to read and digest, I must say. But there's a lot of other material there, the shorter pieces of writing, there's some video material, there's infographics, and I hope you get a chance to look at it and find it useful. I'd now like to just say a few words about the Sustainable Development Goals because they're very relevant in this context. And while I was at United Nations University, as well as being involved with the Lancet Commission, we were also helping to shape the SDGs, and in particular, thinking about human health in relation to the Sustainable Development Goals. Of course, before the SDGs, we had what were called the Millennium Development Goals. They were a smaller set, just 8 goals, and a number of them were specific health outcomes. But this new set of goals that all nations agreed to in 2015, including Australia, has signed up to them. These goals bring together a focus on poverty eradication and sustainable development for the first time. And goal 3 is specifically the goal for health. But it's important, I think, when we think about all of the goals, to think about it in this way, which the World Health Organization, this is their infographic for the SDGs, and they've got human health and well-being at the center, and the other 16 goals around the outside. And this makes clear that all of these other goals are what we might call determinants of health, whether they're social determinants or whether they're environmental determinants. So no poverty, zero hunger, quality education, gender equity, clean water and sanitation, affordable and clean energy, decent work, and economic development. They call it growth. I would prefer to call it development because it doesn't have to grow endlessly. We might talk about that a bit in the discussion section. Promoting R&D capacity in relation to industry, that's goal 9, reducing inequalities, sustainable cities and communities, goal 11, responsible consumption and production, goal 12, climate action, goal 13, 14, life below water, and 15, life on land, 16, peace and justice, 17, partnerships for the goals. So all of those other 16 goals can be understood as determinants of human health and well-being. Now, a few words too about research and research funding, because I know some of you are actively engaged with universities. And while there hasn't been a lot of research investment in this area in recent years, it's great to see the major funders lining up. So Wellcome Trust, which is the second largest of the research funders in the world, has a program, Our Planet, Our Health. And indeed, the institute I direct at Monash has one of the large grants from this program. It's called RISE, our grant, Revitalising Informal Settlements and Their Environments. It's a program of nature-based solution to sanitation in Fiji and Makassar in Indonesia. It's collaboration across the disciplines. And so it's great to see the Wellcome Trust acknowledging these really important questions. And of course, Julia Gillard is now the chair of the Wellcome Trust. And so it's great to have an Australian connection there in London. Our National Health and Medical Research Council recently made resilience to environmental change one of its strategic research priorities. That's a terrific advance, and I'm delighted that NHMRC is taking this seriously, and indeed they currently have an open call. Their special initiative in human health and environmental change, applications open until the 31st of March, and a number of Newcastle-based colleagues are part of the conversations that we're having. Brian Kelly, for example, among them, with his interest in mental health and climate change. The challenge of prolonged droughts, the impact, the drying of the soil, reducing the incomes of farmers and affecting the mental well-being of farmers and their families and wider communities. You know, we need to understand these issues better. And then journals are getting interested in this kind of transdisciplinary research. Nature Sustainability, established 2 years ago, and on the right here, the Lancet Planetary Health, established after the commission in 2017, and I'm greatly honoured to be on the board of the Lancet Planetary Health, and we're really encouraging researchers to publish their work in the journal, and I'm sure they would be interested to hear from hunter-based researchers, and perhaps have already published some of your good research. Now, I'd now like to turn, I guess, to a broader discussion of the importance of human ecology as a way of understanding patterns of human health, if you like, alongside epidemiology in research, education, policy, and practice, bringing human ecology into the conversation. And I refer here to the work of Stephen Boyden, very eminent human ecologist from Australian National University. This is one of his books, The Biology of Civilization, Understanding Human Culture as a Force in Nature. That's what the Anthropocene's about. And indeed, after this lecture tonight, I'm having dinner with Stephen here in Canberra to celebrate his 95th birthday. He's still writing books, still very engaged, a remarkable person. So let's look at some of his ideas. In health research, in public health, quite a bit of what we look at is the way human activities, the things that people do, human behaviours, if you like, the way those things affect health, whether it's positively or negatively. And we talk about behavioural risk factors. There's a lot of attention given to that. We also, in more recent decades, have sharpened our focus on what's called the social determinants of health. And this is the work of Michael Marmot and others, for example. And these are things that we do. These are human activities, but things that we agree to do collectively in the interests of the health of people, or they're things that we agree to do together that may actually harm the health of people. So a good example would be our tax system. If we have a tax system that provides a social safety net for people, as we do in Australia, as perhaps they don't in the United States, but over time, are we continuing to improve those redistributional arrangements? Are we supporting our unemployed with a reasonable rate of unemployment payment, for example? These are social determinants of health. They're human activities that we do, things that we agree to do together. But there are a range of human activities that also have impacts on the environment, the environmental impacts of development. For example, we agree to make power in New South Wales at the moment. We agree as a community to make it through our government, make much of it from coal. That's what we are agreeing to do. Now, some of us don't agree with that, but collectively that's a human activity that the people of New South Wales are responsible for, and it has impacts on natural systems. It has impacts on climate stability. It pollutes our waterways, our land. It harms the health of people directly, not just through the greenhouse gas emissions and climate change. So we have to be thinking about all of these human activities and what they mean for the planet, and then what they subsequently mean for human health and well-being. And we now call these the ecological determinants of health. It's a term that was introduced by our colleagues in Canada, a major report from the Public Health Association in Canada. So we have a focus on social determinants, but also on ecological, and we need to spend more time and resources understanding these links. And you can see in this final slide in this series that I've also put arrows in the reverse direction to remind us that we need to think in systems, because a decision we make in one societal sector will have flow-on consequences in other sectors, and we need to think about those and plan for them and avoid unintended consequences. And of course, the emblematic example is a decision to stop making coal, using coal to make energy in New South Wales, would impact the livelihoods of people who currently depend upon that. So if we are to do that, we need to have a transition plan. We need to be thinking about livelihoods for the people who currently depend upon that. And so this, as I said, this is Boyden's biosensitivity triangle, and indeed there's a link to a free book. It's called The Bionarrative, and you can download it from that ANU book. And Stephen published this most recent book when he was 90 years old, and it's I can tell you it's a very good read. The story of life and hope for the future. So let me conclude with a couple of final slides. This one here is an infographic that we're now using to explain what we mean by planetary health. And you'll see here at the top of the slide, we understand planetary health as a cultural transformation. And this long sentence, it's about safeguarding the health and well-being of current and future generations, not just current, but also future, through good stewardship of Earth's natural systems, and by rethinking the way we feed, move, house, power, and care for the world. And so over on the top right-hand side here, you can see Boyden's biosensitivity triangle, the things we do, the health of people, the health of the planet. But this big circle in the middle, how do we manage ourselves to leave no one behind? That's a language from the UN. It's about fairness and justice and equity. And so how do we manage ourselves, manage the things we do to optimize, if you like, for human health and for the health of natural systems? This will require changes in culture, in mindset, in values. It'll require us to learn about things that perhaps some of us don't know about. Many of our elected officials in our parliament houses in Canberra, in Sydney, elsewhere, many of the people in those parliaments didn't learn about climate change at school, unlike the current generations of young people in Australia. So we need to support those elected officials. And as a sidebar at Monash University, we've established a new institute called the McKinnon Institute, which is about education opportunities for elected officials so that they can benefit from these understandings in the decisions they make. So at the bottom of this figure, you can see what we've called 5 big pathways, and that's these, how we feed the world, how we move the world, how we house the world, how we power the world, how we care for the world. These are big societal sectors, big industrial sectors. How do we do things differently so that we're optimizing, as Stephen Boyden would like us to, not just for human health and well-being, but for the health of natural systems? Because our health entirely depends on natural systems, we must bring the planet in to our decision-making. And the bottom line is that our future depends on the health of our natural world. That ultimately is the bottom line for all people on Earth. A couple of final mentions. I'm working very closely with Nick Talley on the editorial board of the Medical Journal of Australia, and Nick's encouraging me to work with others and sharpen the focus on these planetary health issues in the journal. We've had a series of themed issues, one a year, and we also now have the MJA Lancet Countdown on Health and Climate Change, and that report for 2020 will be launched tomorrow. So it's very timely that I'm talking with you this evening. So my final slide, the so what does all this mean? What should be different perhaps? So I've got 5 points here. First, we need an eco-social approach in the way we understand health alongside our biomedical understandings. We need to recognize the ecological, economic, and social determinants of health and really understand the intersections between these things much better than we currently do. We're getting there, but we're not there yet. We're getting better on the social. We've got to integrate with the ecological. Secondly, systems thinking, critically important when we're grappling with these complex problems, these wicked problems, some people call them. And here, acknowledging the interdependence of all species on Earth. When we're not bad at acknowledging the interdependence of people, although we still have lots of conflict on Earth, but we're not so good at acknowledging the interdependence of all species, all animals, not just the humans, all plants on Earth, and indeed all microorganisms, those we cannot see there in brackets. We've spent much of 2020 trying to control a single microorganism, but we must always remind ourselves that to be here and healthy today, enjoying this experience of sharing these ideas together, we need trillions of good guy microorganisms on our mucosa throughout our body to make sure that we thrive. And so it's really important that we acknowledge that this interdependence. Thirdly, intergenerational health equity. In schools of public health, including at Newcastle, there is a lot of concern about health disparities, health inequities, and that's important. Notably, though, much of that work doesn't have a line of sight to future generations. And that's one of the things that's different about a planetary health lens, is that we are bringing future generations into the conversation. And as I said earlier, that's indeed what Indigenous people do in the way they understand the world and the way they think about their responsibilities as custodians of land. And that brings me to point 4, to really shout out the need for us to value Indigenous and local knowledge. And this is at the heart of a transdisciplinary approach, transcending academic disciplines. Yes, valuing those academic disciplines, but also valuing the know-how from people in policy, people in practice, people running businesses have know-how. We need to value that, and we need to value Indigenous knowledge as well. And so my final point, perhaps a summative one, would be that we need to bring a planetary consciousness into everyday life in all of our decision making, whether it's a decision of what we eat tomorrow morning. We need to not just be thinking about what that will do for our personal health. We need to think about what those food choices will do for the health of natural systems. Similarly, with how we get to the university when we're allowed back. Are we going to do that in a way that's good for our own health as well as for natural systems? That would be an active mode of transport, walking and cycling perhaps, or using mass transit. Rather than using the private motor car, particularly with one person in it, for example. So there's lots of things, lots of everyday ways that we can bring this kind of thinking in. So back to you, Paul. I'll stop sharing there and look forward to a lively discussion.
Okay.
Apologies. No, thank you, Tony, indeed. If I can in turn then throw to John Aitken, who probably has some questions he can put to you and your panellists.
Well, first of all, I'd like to thank Tony for an excellent presentation. It was certainly very powerful, very challenging, in many ways very concerning, and also very complex. Because clearly the solutions that we face as a planet are very complex and cannot be solved on a discipline by discipline basis. It requires the multidisciplinary approach that you mentioned. But it does seem to me that there is an elephant in the room which wasn't really mentioned. And that is the reason why we have forest fires and the reason why we have global pandemics is because population density has reached an unprecedented high. It's populations that drive environmental degradation. And yet somehow in the Sustainable Development Goals, I didn't see control of the world's population as being an important part of that. We are to some extent, as you pointed out, living longer than we ever did before. But in many ways, from a population perspective, this is a bad thing because we just create now population momentum. But at the same time, fertility rates are showing a global decline all over the world, with the exception of sub-Saharan Africa, maybe Afghanistan. Fertility rates are now below replacement rate. So I would just like the panel to reflect on this. So how important do you think it is that the world's population is got so much momentum behind it. It's continuing to grow. No matter what we do, it's going to continue to grow for another 2 or 3 decades. And to what extent do you think it will self-correct, that in the end, what we are doing will suppress our own fertility and the population will decline?
Yeah, no, that's a really important question. Shall I jump in first and then pass to the other panelists? How does that sound? You're absolutely right. There was no mention of population, and indeed, there's no direct mention of it in the Sustainable Development Goals. We do refer to it actually in the Commission, and sometimes I do actually present a slide about it. I must admit that I forgot to go back to the full slide set tonight. But that said, I think there are some important things to say about population, and you're absolutely right. When you look at impact on the Earth, on natural systems, there's this rather well-known equation. Impact equals population multiplied by affluence, multiplied by technology. And so population is definitely part of the challenge, and frankly doesn't get much discussion around the world, partly I think because some religious organizations really don't want human fertility discussed. And you know, one of my slides in the when I give a presentation like this is often one about family planning, and the fact that, in fact, if we invested in family planning and enabled the many women who don't have access to family planning, I think the estimates are more than 200 million women around the world don't currently have access to modern methods of family planning. It would only cost us $5 billion a year, but there are political reasons why this is not being delivered for the women of the world, and some of them emanating from the United States, in fact. But yes, education of women, we see as we see women enabled to participate in education, we see declining fertility rates. But perhaps I'll stop there and pass to my colleagues who may have other comments to make as well.
John, would you like to go, or Georgia first?
Georgia, why don't you have a go?
Go for it now.
Georgia, you have a word.
Thanks, John. Thanks, Tony. Tony covered the answer to the question, I think, quite comprehensively. I will add, though, that this is quite a tricky topic to discuss because it does bring up ideas about how populations should be controlled and who, I guess, polices that and sets the policies for that. And I guess which populations in different parts of the world should be controlled more than others. There's definitely some argument about how this as an issue might actually detract from more robust system change on the climate, because it does provide, I guess, some scope for people with, I guess, some discriminatory views to use this as an argument for pursuing action on population control and I guess techniques around, well, capping populations in certain areas of the world, rather than refocusing the conversation on systems change in an interdisciplinary way that is focused on human and ecological health. So I think this is a really important discussion to have, but it is one that cannot be had in a silo at the exclusion of talking about other strategies to manage climate change.
Sure. John van der Kellan, have a view?
Yeah, sure. So the population issue is a big issue, of course, and as the population rises in the world, that's going to only put more pressure on our resources. But we have a certain element of urgency now And we have 7 billion people now, and we're living beyond our means now. And even if we reduce our population over the next 5, 10, 20, 40 years,
10 minutes,
that's good. But we all have to reduce our emissions straight away. And this urgency of, getting our consumption under control, I think, is more important than the debate about controlling population growth. And this idea of planetary consciousness, I think, Tony, is fantastic, because really that's the issue. It's really getting everybody to start thinking that they have to think about what they're doing every day and change their behaviours.
Yeah.
Okay, that's fine. I think John's point was, though, that this is a major determinant and we shouldn't ignore this, not that we should not proceed with the other initiatives. So, John, look, let's move on. I think it's a good point we've explored. Any other themes in the questions?
Yes, there are. Let's go to the GDP question. So Guy Lukes has sent in a question which is very complex, and to summarize one component of it, he says it makes no sense at all to elevate economics above the biosphere. And I remember, I'm old enough to remember the blueprint for survival. So it was in the 1970s when Nature published a paper pointing out that economies can't continue to grow if they're based on finite resources. And in the end, you're going to have to achieve some kind of equilibrium. You know, we didn't listen then, we are not listening still. Why do you think it is so difficult for this message to get across that stability, sustainability is important? And anybody can answer the question.
would John or Georgia, would you like to go first? I'm happy to say something at some point, but also happy to.
Oh, you go, Tony. That's fine.
Yeah, no, I mean, this is a really important question, and the whole area of limits to growth, you know, I think it's sort of been squashed and besmirched, but interestingly, we have seen a renaissance through the use of the framing of planetary boundaries, I think, in recent years. So essentially that is around limits, but indeed there's no mention of population in that one either, John. And, but at least it does start to talk about boundaries and limits. And, you know, I think frankly, we will come a point on Earth, you know, at some point where populations won't be growing, and you know, perhaps it'll be more pandemics that actually decrease population numbers into the future. So you know, there is going to be some point where we're going to have to start asking questions about why do we need more money when populations aren't growing? And indeed, countries like Italy and Japan, already the populations aren't growing, and so there is no sensible argument for more money when populations are declining, you know, and of course we know from health research that any of us only need a certain amount of money to live well, that in fact once you get too much, you actually can end up with stress and problems holding on to all your money. You know, it's kind of like it's so I think that you know, it's this difference between consumerism and materialism. So consumerism and wasteful consumption, whereas materialism can actually be understood to mean that we're really valuing the material things in life. We're keeping all of our things for as long as we can. We're repairing them. We're adapting them. We're loving them long term, rather than just throwing them away. So I think there's lots of stuff in that rather garbled answer there, John, but I might throw to the others.
John, I wonder if I could intervene and just ask for a bit of guidance from Stuart. We should have in mind a completion time, and I wonder if that should be 7:15.
That would be just 5 minutes over our schedule.
We are, or
we're right on schedule to finish now, but
Okay.
we did start 5 minutes late.
Can I squeeze one more question in then?
yeah, it's one or possibly two. Yep.
Okay, good. So George Paxonos asked a question on the Q&A panel, and he asked whether forest fires and the expected loss of all corals at 2 degrees warming means that we're destined to become the first continent to be significantly degraded by climate change.
Well, one of my other hats is actually as a landowner, and I grow some forest as well. And clearly, over the last 10, 20 years, our land has changed dramatically. It's dried out, it's got hotter, soil moistures are declining. So we're already in the throes of declining environment. Will we be the first continent? We're such a large continent, I guess, and some areas seem to be getting more rainfall, etc. I don't think we'll be the first, but certainly we're seeing all the ecological damage day by day.
Yeah, I think that the ecological margins in Australia are very narrow, so you don't need to take much away and the ecosystem would collapse. So I think we are very vulnerable. And if I could have just one last question, maybe to Georgia. And the theme throughout this talk has been how complex the world's problems are and how multidisciplinary the solution has to be. And from an educational point of view, maybe from a medical educational point of view, do you think that you get exposure to the kind of One Health or planetary health concepts that are going to be necessary to address the future?
That's a really interesting question, John. I am mindful that there are people in the faculty that are participants on this call as well. And the degree structure of our medical school is currently undergoing quite a lot of change at Newcastle. So I can't speak on the current course structure. But I think it's something definitely that we get a little bit of exposure to when we are talking about the social determinants of health and looking at public health through medical education. But I don't think this can be generalized to other medical schools because every curriculum is quite different. And I think the majority of the education about planetary health, especially as an evolving concept in the public health sphere, is something that we probably get more exposure to, especially in Australia, through media and through extracurricular advocacy work that is driven by the health sector, rather than a lot of complex teaching about some of these interactions with health and the natural environment through medical education as it stands.
Look, Paul, I think we could go on for a long period of time, but I think time has beaten us. So perhaps I will thank the panel and pass you back to Paul Jeans as chair of the meeting.
Thanks, John. And Tony, thank you very much. And John and Georgia for your work as panellists. It's been a riveting presentation. And I think, to John's point, you've whetted, a lot of appetites tonight and given a lot of references to where we can go. And I must say, from the University of Newcastle's perspective, it was a very interesting exercise over this past year to take our new looking forward plan, which is much more interdisciplinary, and gauging it through the lens of the Sustainable Development Goals, which we did. And it was very informative, I think, to all of us to go through that process. So I think there's certainly a growing awareness, no doubt there are gaps. And I think tonight has helped to bridge some of those gaps. So on behalf of the Royal Society, and particularly its Hunter branch, thank you very much indeed for sharing that very professional presentation with us. Thank you, John. Thank you, Georgia. And John Aitken for moderating the session and promoting his field of expertise at the same time. So best wishes to you all. Thanks. Have a joyful end of 2020 and take care. Thank you very much.
Thanks very much.
Thank you all.
Terrific.
Thank you very much.
Yes.
Thank you.
Bye-bye.
Okay.